Welcome back to BRMC's Healthy Connections. I'm your host, Donna McMullen, and with me today is Dr. Paul Neis, and we are going to talk a little bit more about your role as the sleep medicine director over at BRMC, the medical director there. And would you tell us more about sleep apnea?
Well, sleep apnea is the main condition that we're evaluating people for in the sleep lab. And what is involved with sleep apnea is that during sleep, the airway muscles relax, and many people will then have a complete collapse of the airway, and it stops their breathing intermittently during the night. And there's a full range, which starts from snoring on one end, which is just simply noisy breathing, to on the other end, severe obstructive sleep apnea, where, you know, even up to 400 times a night, someone can be closing their airway down. And so,
oh my goodness,
there are many health effects that come from that. And so, if somebody shows symptoms of snoring, maybe being seen that they stop breathing during their sleep, particularly if they're tired during the day, fall asleep easily, then it's worthwhile getting checked out for sleep apnea.
Okay. If someone then came into, what would the whole process involve? Would they come in and see you at the office?
Well, certainly my office is always open for anyone to schedule an appointment to come there, but probably most people start with their family doctor.
Okay.
And speak with their family doctor about whether they might have the sleep apnea, and they do an evaluation. And there are two ways it can go from there. That physician can just directly order a test for the sleep lab.
Okay.
Now, I as a medical director have to review some records from their visit to see if it looks like it's appropriate. Or the other choice they can do is send the patient to me and then have me do an upper airway evaluation and then order the sleep study too. And there's no right or wrong on that.
Okay.
It depends on individual
So the
circumstances.
primary care physician. Okay. When someone actually comes into the sleep lab then that's located in BRMC, what's done? What happens while they're there?
Well, usually the person will show up an hour or two before their normal bedtime. The technician will go over the process of the sleep study with them, and then we'll fit them with monitors. And we are monitoring numerous things during the night. We monitor the oxygen level in the blood, their electrocardiogram tracing to check for heart rhythm, movements of the chest and abdomen, airflow coming out through the nose. We check an EEG tracing to see when they are actually asleep, limb movements, and so there is a lot of data that's being recorded there. Then the technician will put that person to bed, and the rooms are kind of like a nice hotel motel
suite.
room.
I've been up there to see them. And
big queen bed, and the bathroom there in the room, and a reclining chair. And then while the patient sleeps, the technician is monitoring the information. Many of the cases, if there is significant sleep apnea, it will actually be done as what's called a split night study, which means after the sleep apnea has been demonstrated, then the technician comes in and fits the patient with a machine called a CPAP, which is continuous positive airway pressure. And that is the main treatment for sleep apnea. And then during the second part of the study, we can see how much pressure is needed to keep that airway open, to keep the people
so it's
breathing.
Actually a burst of air?
It's not a burst of air, it's a continuous pressure.
Okay.
Of
oxygen?
No. Now, if a person needs oxygen, oxygen can be put in, but most people don't need additional oxygen. They just need their airway open.
Okay.
And this keeps it from collapsing. So it keeps the flow of air going, and stops them from snoring and stops them from closing the airway.
Oh, I bet there's many, and I don't mean to pick on the gentleman, but I would think this is more, well, is it more common in men than women?
Sleep apnea is more common in men, but it certainly has been becoming more common in women. And anyone can have sleep apnea, but there are certain risk factors that go in. to it. One, we all inherit a shape of our jaw and our neck and our head, and sometimes family
Combinations.
types, like a short, broad neck, round face, more likely to have sleep apnea than someone with a long, skinny
Really?
neck.
Interesting.
Also, whether the tongue is large and the jaw is small. But certainly the major factor that's made sleep apnea become much more common is increasing weight. Our population is becoming
my
heavier.
Goodness. Sure.
And people with a body mass index over about 34 have about a 75% chance of having sleep apnea no matter what their upper airway is
I'll
like.
be darned.
But I mentioned earlier about doing an upper airway evaluation because certainly if you can't breathe through your nose, you're more likely to have sleep apnea. So there are a number of things that need to be evaluated and addressed.
What do you do for patients? I'm just envisioning all of these being all hooked up to everything that you mentioned as part of the procedure and thinking, I don't know if I could fall asleep if I had all of this on me. Do sometimes people take a sleeping pill or
Occasionally someone needs a sleeping pill. If they don't have to have one, we'd just as soon not. But we have a standing order for patients that I'm going to read for a very short-acting sleeping pill to help them get to sleep. However, most people don't need that.
Really?
Amazingly enough.
Yeah.
You know, the monitors are some very fine little plastic-covered wires, and they just go up to an attachment on the top of the bed. So it's not as onerous as it might sound.
Okay, all right. I just had a vision there for a moment. But having seen the rooms, those certainly are wonderful.
They are.
They're very attractive. They're very inviting. So certainly I could see folks probably getting very comfortable very quickly then, as long as the equipment that is being attached to them isn't some sort of obstacle to their falling asleep. So,
Correct.
But, how do you diagnose sleep apnea then? Is it always through the, is snoring would be one factor?
Well, as I said, the snoring, someone witnessing them stopping breathing during sleep,
breathing,
and the
okay.
daytime tiredness.
Tiredness, okay.
But as far as the diagnosing, first you have a suspicion based on those things, and then comes the testing, which the best is the in-house sleep lab, like we do, and that's called an attended sleep study. There are some people that are pushing for more home sleep studies, and you know, overall, it's still not to the point where those are as reliable as an attended sleep study. There are lots of complications. Monitors come loose during the night. And for one thing, almost none of the home studies show whether the person was actually asleep. So you're getting some readouts on breathing and heart, but you don't know how much time they were asleep. And thus, Medicare and Medicaid are usually the first to go this way. They will not let you give CPAP based on a home study, an unattended study. And usually the other insurance companies will follow.
Right.
But I find that we get quite a few patients in to the sleep lab to do a full polysomnogram who have had a home study. Somebody has already prescribed CPAP and we find out they don't have sleep apnea. So I still feel it's the better test.
Leave it to the professionals would be the route to go, yeah.
It's like anything in medicine. There are ways you can cut corners and do less, but when you do, it's less reliable. You're less sure of the results.
Right.
Say, like with the advent of CT scan, chest x-ray versus CT scan. You might suspect something from the chest x-ray, but the CT shows you what's really going on.
Really going on, you bet. So, well, my goodness, today I'm so much, so much good information. Well, I want to thank you so much for being here with us today, sharing all this information with our viewers. They've learned a lot. How would someone, if they wanted to contact you at your office, how would they reach you?
Well, our number is in the phone book, Ear, Nose, and Throat Associates of Mountain Home.
I'll keep the eye out of it, so. Ear, Nose, and Throat Associates, okay.
Yes,
All
and it's 424-4200.
All right.
But it's usually fairly easy to get in to see us in a timely manner.
And it's always important, too, for anyone that suspects that they or their significant other, their spouse, that type of thing, might be suffering from sleep apnea, to go ahead and have it checked out first with their primary care physician and see what they feel is going on, and then you're right there to help them along the way as well. So,
Yes.
with our sleep lab program over at BRMC. So, thank you
Certainly.
so much for being here with us today. We
Well, thank you for having me.
Greatly appreciate it. You've helped a lot of folks and given them a lot of very valuable information. So thank you again.
Well, thank you.
Join us again next time for BRMC's Healthy Connection. We'll see you later on. Bye.